Hi, I'm Louise Wood and I co-lead the NIHR, and I'm really delighted to be supporting the UK's first Dementia Researcher Careers Festival.
To be successful nowadays in science, you need diversity. You need people from all kinds of walks of life.
We know that for every scientist working in dementia research, there are 4 scientists working in cancer research.
We want to supercharge the next generation of scientists to make the much-needed breakthroughs in both the understanding and intervention in the diseases that cause dementia.
And we have no treatments. We have treatments for cancer, we have treatments for heart disease, but we don't have treatments for the undignified death of dementia.
So nowadays you need chemists, biologists, mathematicians, bioinformaticians, medical doctors, psychologists.
So please think seriously about how you can bring your talents and insights into tackling this awful disease.
Hi everyone, thanks very much for joining us today. I hope you can all see my video. My name's Stuart Gillespie. I'm the Communications Manager at Dementias Platform UK, or DPUK. For those of you who don't know us, DPUK is a national research programme and network funded by the Medical Research Council and based at the University of Oxford. And our aim is to drive forward research into dementia through access to data, through experimental medicine, so that we can speed up those efforts to find new treatments or to prevent or delay dementia. Today's webinar is, of course, part of Dementia Research Careers Week, coinciding with National Careers Week here in the UK. We've got 4 fantastic speakers today whose backgrounds and areas of research span psychology and dementia care, and they'll be talking to you for about 10 minutes each about their careers to date. And although I'm not a dementia researcher, my job is to communicate the research, what really strikes me is the sheer variety of ways to become involved in dementia research, whether you want to work in the lab with public volunteers, as a data scientist to improve the care of those with dementia, and so on and so forth. And if you visit the new careers section of the Dementia Researcher website, you really get a sense of that variety, from webinars like this one, podcasts, blog posts, and lots more in the way of useful content and resources that showcase the different types of dementia research and how you can forge a career in this area. So without much further ado, I'll introduce the first of today's speakers. And for those watching live on Zoom or YouTube, you can post questions for the speakers at any time during the event in the relevant chat or comment box. And at the end, my colleague Adam Smith from the Dementia Researcher Network will run a Q&A. And remember to specify if your question is for a particular speaker. That'll be really helpful. So first up today is Jemma Pitt. Jemma is a PhD student at Oxford University and has an undergraduate degree in psychology and a master's in neuroimaging. Jemma is particularly interested in developing new biomarkers for Alzheimer's to help us diagnose and treat the disease as early as possible. So take it away, Jemma. You can come off mute now, and do feel free to share your screen if you have any slides for us.
Thank you so much. Yes, I will try to share my screen. Hopefully this works. Oh, no. I think I'd be good at this by now. Okay, hopefully you can see the screen now. Asking me for a... Okay, I'm going to assume that you can see my screen, even though it's asked me for a password. Would it be okay if someone just lets me know?
I can see it. Thanks, Jemma.
You can. Okay, great. We'll ignore the password then. Yeah. Okay, great. Thank you so much, Stuart, for that introduction and the invitation to present today. I hope you're all enjoying the Dementia Research Careers Week. So yes, I am Jemma Pitt. I am a PhD student in Oxford, and I am trying to investigate Alzheimer's disease using multiple brain scanning methods that I'll go through with you today. So just a little bit about what I do sort of day to day. So the majority of the time I spend is with patients, and these patients of course have a diagnosis in Alzheimer's disease. And we also see patients with a diagnosis of what we call mild cognitive impairment, or MCI for short. And this is the sort of precursor to Alzheimer's disease in most cases, where somebody complains of a memory problem that is worse than somebody else of their age, but they haven't quite got a diagnosis of dementia yet. I then spend a lot of time with these patients performing different types of memory tests to assess their ability. So this ranges from short-term memory, long-term memory, and also things like language and attention and orientation, as of course there's many different types of memory that can be affected with Alzheimer's. We then also perform different types of brain scans with these patients. So majorly this is MRI and MEG brain scans, which I'll go through a little bit later as well in a bit more detail. And then lastly, as you can imagine, we spend a lot of time analysing this data. So trying to find differences between the different groups of patients that we have with the different types of memory test and the brain scans as well. So the main study that I work on during my role here at Oxford is a study called New Therapeutics in Alzheimer's Disease, or NTAD for short. A lot of studies have these acronyms, so you may come across many of these during your time in research. And this study is joint with Oxford and Cambridge, as well as different pharmaceutical companies. And we are interested in creating a drug to help patients in the very early stages of Alzheimer's disease. So just a little bit more about this NTAD study and what we look for. So we recruit patients, as I mentioned, with Alzheimer's disease, mild cognitive impairment, and then of course healthy controls. So these are elderly patients that don't have any problems with their memory, and we also test to see if they've got any of the markers for Alzheimer's disease as well. So we ask quite a lot from these participants, but this is just a summary here. So first of all, we do lots of different types of memory tests with them. And here's just a list of some of the ones we do that you may have heard of. And it's really important that we do a variety of memory tests just to get the natural performance of people, as some people are better at certain things than others, and etc. The first type of brain scan that we do with them is the MRI brain scan, which you may have heard of before. And you can just see an example picture here. And this is just a very beautiful structural picture that we get of someone's brain. So we get to see all the intricate details and everything that's involved. The second type of scan is the MEG brain scan, which is a little bit less common. And here is a picture of just somebody sat in the scanner here. So you can see they just sat in a chair with the scanner just on top of their head. It just touches the top of their hair. And what this scan does is it records all of the brain activity that's coming from the brain, of course. So this is more of a functional scan. And I have an example here of some data that we collect from the MEG scan. And each line here represents a different sensor inside this scanner, recording that brain activity. So you can sort of imagine this as a little jigsaw puzzle. We get the structural picture of the brain from the MRI scan, and then we have the functional brain scan from the MEG, and we put the two together and we're able to see exactly where in somebody's brain the brain activity is or isn't happening in some cases of dementia. So just to show you some examples of things that we look for using these types of scans. A very common observation is a part of the brain called the hippocampus. And this area is crucial for memory and is one of the first parts of the brain to deteriorate in dementia. So as you can imagine, patients with Alzheimer's have a lot smaller hippocampus than the normal control, so somebody else of their age with no memory problems. And what we want to do is develop a new biomarker or biological characteristic that is sensitive to early Alzheimer's disease. So as you can imagine, if somebody comes into the memory clinic and complains of some memory problems, before they get to the stage where we may not be able to help, we want to create some sort of test in the middle here, which we can give to patients to administer a drug and decide what sort of treatment might be most useful for them. So just to give you an example, hopefully this video works, of what a brain scan looks like. This is an MRI scan going through each slice of the brain. And in yellow there, you can see a very beautiful normal hippocampus, and that is the right side. And as the MRI goes through every slice, we'll then get to the other side of the brain, where again, we'll see a very normal looking hippocampus. So that, of course, is in comparison to an Alzheimer's patient. So this is the same sort of scan, but this time we have a patient with a Alzheimer's dementia diagnosis, and we'll go through that scan together. And as you can see already, the hippocampus here in yellow again is a lot smaller, and you can see some deterioration happening next to the hippocampus and also at the top here. And hopefully you can see the video. It will just continue through each slice of the MRI scan to the opposite side, where again, you'll see the hippocampus in yellow. which is a lot smaller, and again, all of the deterioration that may have happened because of this dementia. So it can affect quite a lot of the brain, which is very sad to see. So there's many other things, of course, that we can do with the data that we collect from the different types of brain scans and with the different groups of patients as well. And I just wanted to show you one of my favourites from a certain type of scan called diffusion tensor imaging, or DTI, which measures the direction of water travelling through the brain. So as you can see in the picture here, and again, I hope my video here works, that each colour represents a different direction that the water is moving through the brain. So we get a really detailed, beautiful looking image of how the brain is working. And we would expect that in an AD patient, there may be some areas of the brain that the water does not travel very well. So we can really see that here in some beautiful pictures. So just wanted to go through a little bit of my career path, just an example of how I got to where I am today, very luckily. So after my A-levels, I was really torn between studying computer science or a psychology degree. But I ended up going to Cardiff University in 2013 to study computer science. But after about a year, I decided that this may not be for me, as I wanted to spend a little bit more time with patients as well behind a screen. So I did a little bit of research and I found what I thought was the perfect mix between computer science and psychology, and this ended up being a master's in neuroimaging. So to get to this master's, I swapped to a psychology degree again in Cardiff in 2014, and then luckily then joined that master's course in 2017. So during this time as well, I also volunteered on the mental health ward and a brain traumatic injury recovery ward as well, just to spend lots of time with patients and just to make sure that it definitely was the right career for me. In 2019, then I was really lucky to get a job in Oxford, where I was doing a research role in the Dementia and Aging Research Group. So being involved then in many types of studies here at Oxford with patients and dementia, which was great. And then took that experience and sort of created some of my own ideas. And then only a couple of months ago, then in 2020, I started my PhD here then in Oxford as well. So I just wanted to say a few things about why I love dementia research. The first reason, of course, is I get to spend lots of time with patients and their families. And I put this first, as I really do enjoy spending time with people. Each person and their family has their own story about how it affects them, and it is really fun to get to know this. Secondly, then I feel like I'm contributing to something very important. This is especially true as a lot of Alzheimer's drug trials have failed recently, which may be due to the fact that drugs are given too late into diagnosis. So as I mentioned, we're trying to create this test to give to patients to try and diagnose them and then administer the drugs as early as possible. This then leads on to the fact that it would be lovely to know that we've helped some patients in the future. And then lastly, of course, I just love looking at pictures of the brain. There are so many cool things that we can do with these pictures, and I'm sure I annoy many of my friends constantly showing them different pictures that I've created day to day. This is a lovely picture here of one of the first patients that we recruited from a similar study here in Oxford. So it just goes to show that we are helping as many people as we can. Also, just wanted to give you a few tips of why dementia research may be for you. So I definitely recommend a career in dementia research if you really enjoy spending time with patients and people. You may also have a personal connection that's sort of driving you into this research area as well, which can really help. You may be really interested in brain data and seeing new methods being developed. So the picture I showed you of the different colours and the water direction in the brain, that's very new, and it's really exciting to see that being developed in this sort of career as well. And then same sort of thing. If you enjoy seeing the data that you collect come to life in the forms of pictures of brains and graphs and exciting things, it can be really nice to be involved in something being developed there as well. So lastly as well, I just wanted to give you a few tips, things that would have helped me potentially as I was going through my career path. So as I mentioned, look for future courses that interest you. So looking for the perfect mix between computer and psychology, and ending up in neuroimaging was absolutely perfect for me. Also volunteering and working with patients, as I mentioned, is really good to know that this is definitely the right career path for you, and of course very good for the CV at the same time. Whilst working or doing any sort of courses or degrees, it could be really useful to ask around if any PhD students or postdocs would let you help on their project. I know for myself, whilst I was doing my master's, there was a project being done at the time with a Alzheimer's dementia study on the MEG scanner, the MEG scanner, and this really helped me stand out in my interview and helped me get the job here in Oxford. And then lastly as well, don't rush into a PhD. This isn't the only career path. There are many ways to be involved in dementia research, such as a research assistant. So it's just more important to find a research question that you love, and then you'll end up hopefully being very happy in that career. And thank you. Any questions, please do let me know. I'll stop sharing my screen now. I hope this works. There you go.
Thanks very much, Gemma. That was brilliant. Thank you. Really interesting to see the brain imaging in action and to hear about how much face-to-face interaction with volunteers and patients is involved in your role. So please do remember to submit your questions on Zoom or YouTube, and we'll get to them at the end of all the presentations. Our second speaker is Dr. Claire Lancaster, a research fellow at the University of Sussex. Claire's research looks at early detection of Alzheimer's disease and risk of Alzheimer's, with a particular focus on the APOE gene that's associated with Alzheimer's disease. So over to you, Claire.
Okay, so I'm just going to share my screen. Hopefully you can all hear me okay. Can you see that okay?
Yep, can see that. Thanks, Claire.
Okay. So like Stuart said, I'm an Alzheimer's Society Research Fellow working at the University of Sussex. So my research is really interested in investigating patterns of aberrant brain activity in people who carry a genetic risk factor for Alzheimer's, known as the APOE E4 gene, and whether we can kind of modify patterns of aberrant brain activity as a new avenue for early life intervention. So thinking about how we can prevent future Alzheimer's disease is really central to my research, especially, as Jemma mentioned, because a number of therapeutics which have been developed, which are aimed at either kind of treating or slowing pathology in the brain after the onset of dementia, have had limited success. So it's really important to kind of think about how we can prevent the damage occurring in the first place. And furthermore, we know that Alzheimer's disease is characterized by an extended preclinical phase. So that means if you look at this figure on the right, that some of the kind of pathologies of Alzheimer's, such as amyloid and tau accumulation, actually start to kind of build up decades before an individual might first kind of go to a memory clinic to report problems. And this kind of extended preclinical phase gives us a really nice window in which to act. So thinking about how these kind of covert changes in the brain might start to outwardly manifest is one of the things that first got me interested in a career in dementia research. And I'm really interested in three main questions. So first, how can we spot individuals in the very earliest stages of Alzheimer's disease? Second, how can we best characterize people who are at risk? So we need to think about how both our genes can influence our likelihood of future dementia, and also how lifestyle factors and health factors, which are potentially more modifiable, also impact risk. And now that we started to identify risk factors for future Alzheimer's disease, we need to start unpicking how these risk factors actually exert their detrimental effects. And finally, what kind of actions can we take to manage the risk of future neurodegeneration? And although Alzheimer's disease is often thought of as a diagnosis of kind of older adulthood or later life, I would argue that we actually need to kind of shift the focus of our research much earlier in the lifespan to kind of really understand the kind of early stages of the disease. And as such, a lot of my work is completing research with people who are kind of middle-aged or young adults. So by mid-adulthood, we may be able to detect people who are in the very earliest stages of Alzheimer's disease. So this is a really kind of promising area of research, but a lot of the methods we rely on at the moment, such as kind of PET scans or MRI brain scans, or even kind of looking at the content of somebody's cerebrospinal fluid, are expensive and very invasive and kind of difficult to access in a general healthcare context. So I would argue that we need kind of sensitive measures, which are more kind of disease specific. So able to tell apart Alzheimer's disease from memory impairment resulting from different kind of changes in the brain, and scalable tools, i.e. accessible to large numbers, to really kind of progress the field. So I think cognition is a kind of really interesting tool to think about. So how can we assess it? too often we rely on kind of blunt pen and paper measures, which are designed to be administered in clinic really quickly and say whether somebody is clinically impaired or not. So I spend a lot of my kind of day-to-day time at work thinking about how we can develop new tasks which are kind of embedded in the neuropsychological staging of Alzheimer's disease, with my most recent postdoc actually kind of moving away from kind of computerized tasks in the lab to smartphone-based assessments which people can complete in their own home. So I've just included a little picture here of one of our episodic memory tasks, which we deploy via the Missouri app, which actually allows us to test memory over durations such as kind of 2 weeks or longer, because people can complete them on their own personal smartphones. So what about identifying individuals at risk of future Alzheimer's disease? So our genes play a pretty important role, and I'm really interested in the APOE gene. So there's 3 different variants of this gene, the E2, the E3 and the E4 allele. And while approximately 60% of the population carry a double E3, approximately 20% carry an E4 variant, and this is pretty bad. So if you carry 1 copy of the gene, you're at approximately 4 times the risk of future Alzheimer's disease. And if you carry 2 copies, you're at 9 times the risk of future Alzheimer's disease. So at the moment, it's our most well-established risk factor, genetic risk factor for future dementia. And what I think is really interesting about this gene is that all the way from kind of childhood, you can see really, really subtle cognitive, functional and structural brain differences. And this suggests that if we can kind of drill down on exactly what's going on with this gene, we might be able to take early action to prevent future dementia. So my current research is looking at what signatures we can act on in APOE E4 carriers to kind of downregulate the risk associated with carrying this gene. I'm focusing a lot on kind of markers of functional hyperactivity or increased activity in the brain, which we proxy using MRI brain scans, which basically look at where oxygen is being delivered to in the brain as a marker of which neurons are working hardest. So both healthy APOE E4 carriers from early adulthood and individuals in the very early stages of Alzheimer's disease show increased brain activity in regions of the brain which are associated with memory, and also which are very vulnerable to damage in the earliest stages of Alzheimer's, so the hippocampus and structures of the default mode network. We're increasingly recognizing functional hyperactivity as a hallmark of early Alzheimer's disease. And whilst we originally thought it might be a way for the brain to kind of compensate for some of the damage we see in Alzheimer's, it's increasingly being recognized to be more consequential in actually driving the kind of a pathway of Alzheimer's linked pathology. And so I'm kind of interested in how the relationship between cognition and functional hyperactivity changes in the E4 carriers as they age. So is there a link between patterns of increased brain activity and the emergence of subtle cognitive disadvantages? And second, whether we can act on these patterns of increased brain activity to manage risk from earlier in the lifespan. So I'll be completing a study which uses a combination of neuroimaging, cognitive assessment and psychopharmacology to address this question. So previous research looked at the link between epilepsy and cognitive impairment, and they found that asking people with a diagnosis of mild cognitive impairment to take a very low dose of levetiracetam, which is a commonly prescribed anti-epileptic, for 2 weeks, and that following this treatment, patterns of functional activity were downregulated, and that this was directly correlated with an improvement in memory performance. So there's a lot of clinical trials investigating whether levetiracetam can be used to treat the symptoms of Alzheimer's, but I'll be looking for the first time whether it can be used more preventatively. So now that I've kind of given you a quick introduction to my research area, I just wanted to take you through how I'd ended up in this role. So I think I knew that I wanted to do kind of clinical psychology or neuropsychology from kind of when I was doing my A-levels. And this kind of motivated me first to do a BSc in experimental psychology and to follow this up with a master's in cognitive neuroscience. So some of the things that kind of motivated me to pursue a career in research, well, the first thing was I completed a summer research internship when I was doing my undergraduate. And I know a lot of schools of psychology and kind of similar fields offer these between the second and third year of an undergraduate. So mine was funded by the British Psychological Society, and it was in a completely unrelated area. So it was in the psychology of eating, but just taking this time out to kind of run a research project, to collect data and do some analysis was really important in kind of inspiring me to do a career in research. Because I knew I wanted to work in more of a kind of clinical field, I ended up doing my master's dissertation completing research at the National Hospital for Neurology. And then my PhD was also based within the Sussex Partnership NHS Trust. And working with kind of patients in this way allowed me to gain some really kind of important skills. I then went on to do a postdoc at the University of Oxford in something really quite different from what I'd been doing previously. So I was working at the Big Data Institute as part of the digital phenotyping lab. And my kind of main role was to work with computer scientists and software developers to help design smartphone-based cognitive assessments for preclinical dementia. So this role had quite strong industry links. So I was funded by Eli Lilly and Roche Pharmaceuticals. And that's kind of one thing I'd really stress, is that you don't just have to follow kind of a academia only kind of path to complete dementia research, but thinking about how you can collaborate with industry and charity sectors, or kind of more kind of clinical based people is a really interesting route as well. And now I've just started my own kind of independent research as an Alzheimer's Society Research Fellow. So just to finish off, why do I think being a dementia researcher is fun? So first of all, it's really, really interesting. So Oliver Sacks, who's a really famous neurologist, said that the brain is the most incredible thing in the universe. And I do think he's right. So understanding how it works when it works well, and what goes wrong when it doesn't work so well, is just absolutely fascinating. So if you're interested in that kind of thing, then I definitely recommend this career. You're always learning new skills. So at the moment, I'm getting some hands-on neuroimaging experience for the first time. But there's all kinds of different science-related skills and also transferable skills, which you can get experience of. You work with some really incredible people. So not only your kind of scientific collaborators, but also kind of patients and members of the public. And actually working with people who have an interest in dementia research is one of the greatest kind of joys. Impact, so thinking about how you can apply your research to have some kind of benefit for people living with dementia or who might have dementia in the future is really important. And I've put 3 pens. What I'm really trying to say is that you get to go to a lot of conferences, you get to travel and just kind of meet really, really great people. So yeah, you can reach out to me by email or Twitter if you have any questions after this. I'm really happy to answer questions.
Thanks very much, Claire. That was really interesting, especially that idea, I think, of risk factors and intervening at an earlier stage. You know, things like lifestyle factors that maybe we can control, and some like genetics that we probably can't. And I'm sure that we're making big strides in all of those areas. So do keep your questions coming. There's a Q&A box on Zoom, which you can use for that. And we'll get on to our next speaker and come back for the Q&A at the end. So next we've got Dr. Alys Griffiths, who's a research fellow at Leeds Beckett University. Alys completed a PhD in psychology at the University of Manchester and now carries out research into care and support provision for people with dementia and their families. So I will pass over to Alys.
Thanks, Stuart. Let me just share my screen. Can you see the slides now?
Yes.
Great. Okay, so yeah, as Stuart said, I'm Alys. I work at Leeds Beckett University. In terms of how I ended up in Leeds Beckett, so I have, I guess, a similar path to both Jemma and Claire. Did an undergrad in psychology at Bangor in North Wales. And as part of this, I did an internship in my second year. Again, nothing to do with what I do now. Mine was looking at how well humans are able to identify personality characteristics and traits of chimpanzees. So I spent a summer going to the zoo in North Wales, taking pictures of chimps, and then translating those into kind of research stimuli. But what it taught me was that actually research was what I wanted to do. I then went on to do a PhD looking at predictors of mental health problems in people living in areas of socioeconomic deprivation, but also at the time I was working part-time in a care home, and I saw that actually this is a population who are really kind of not thought about, not considered, often feel very second rate to people working in the NHS, as I think has been shown in the past year. And so I also started doing some of my research in care homes. I then took on, this is not a picture of me, this is a picture of my dog doing some data analysis for us. I took on a research role on a clinical trial at the University of Bradford, and then moved over to Leeds Beckett when the whole team moved over, and have progressed there since. Alongside that, I also have some quite personal reasons for wanting to be in dementia research. So here you can see my nan, who lived with dementia for 10 years. She lived with Alzheimer's disease and spent the last few years of her life in a care home. My other grandmother was a care home manager and also a social worker. So I've always grown up around care homes and spent a lot of time in care homes as a child. I also volunteer with a group of people who have young onset dementia and their families, which is one of the most enjoyable parts of my week. And bottom right, that is a teeny tiny me with a grandfather who died in 2005 and probably lived with vascular dementia for 5 or 6 years, but actually the signs and symptoms were never picked up despite him having some of the really clear risk factors. And so my two grandparents' experiences a decade apart really, I guess, motivate me and help me see the difference from a family perspective. Whereas it's great to see it from a research perspective, having that family perspective as well has really helped me, particularly on the hard days. So in terms of the kinds of research that I do, one of the main areas is evaluating complex interventions in care homes mainly, but also outside of that. So I worked on what was called the EPIC trial, which looked at evaluating whether dementia care mapping reduced agitation for people living with dementia in care homes. One of the most interesting parts for me of this was doing the process evaluation and spending that time getting to know the residents, the relatives and the staff, and really understanding why the clinical trial data was coming out as it did. And more recently, we've been looking at the effectiveness of counselling and other psychotherapeutic interventions for people, which is something that I wasn't really aware of a few years ago. And one of the things I love about working in dementia research is that you are constantly learning about new things that people experience or new things that people have access to or don't have access to, and how that varies around the country. I'm also interested and involved in exploratory research that helps us develop understanding. There's still so much about dementia care that we don't know, and we're trying to work out and we're trying to understand. So, for example, there's very little awareness of dementia within cancer care services. So within oncology departments, they don't necessarily have dementia awareness training, they don't necessarily have dementia champions, but we know that a lot of the patients that they will be seeing are probably living with dementia or some sort of memory concern. Equally, I've been working with some people in Malaysia looking at what perceptions of dementia are amongst university students there who are about to go out and be pharmacists or family doctors, who again don't necessarily have dementia content in their degrees, which feels very different to what we'd expect, but actually challenging some of the stigma and some of the attitudes that people have there has the potential to make a huge difference to a lot of people's lives. And finally, challenging existing beliefs. So as a society, we've moved on quite a lot in the past decade around what we believe dementia to be, how important we think it is, how we treat people with dementia, but that's not always been the case, and we do need to continue challenging these misconceptions and stigmatizing views that people have. And I've worked quite closely, you can see the paper called Navigating Meaningful Involvement. That's a paper that I wrote with a lady with dementia about how we involve people with dementia in our research, which is a core part of my role that I'll come on to in a second. But actually, quite a bit of the research that I'm involved in is challenging this and looking at what we believe and looking at the scales that we use to measure things, the way that we measure outcomes. Are these appropriate for people with dementia? How can we improve these so that people with dementia can be more involved in research? And actually, we're asking people things in a way that they can understand and they can work with. And we're not asking people to do tasks that they're never going to be able to do. So, as I said, involvement of people living with dementia and their families is a core part of my role. So I'm the public and patient involvement lead for the research centre that I work in. And this involves lots of different things. So in each of the research projects we have a lay advisory group, which is a group of people with dementia and their families, and sometimes staff as well. And we discuss anything that's important to them in the research and think about what we need to do to make sure that their views are at the centre of it. And they can also help us with thinking about how we should disseminate research, how we should design things. So they're involved from the very start of any research idea all the way through to its dissemination when the results are shared. Also really important is working with people to work out what research questions are a priority to them. As people living with the condition, what matters? What do they wish that they'd known? Or what do they want other people to know so that other people maybe don't have negative experiences that they've had? Obviously, a huge challenge recently has been adapting to the current research climate and having to do most of this online, which has been a steep learning curve for all of us, but actually has had some quite positive results. We had a lay advisory group this morning where we had 10 of us on Teams, and there was people from Brighton, Bristol, Manchester, Newcastle and Leeds. And actually, we wouldn't have been able to get all of us together in a room probably this time last year. So actually, it is presenting new opportunities for us. So in terms of what makes dementia care research so good, obviously dementia is affecting more people's lives, and it gives us the opportunity to make a difference to their lives, but also to the lives of people who will live with the condition in the future. Also developing evidence-based practice and knowing that your research contributes to the evidence is always a fantastic feeling, and being involved in guidance or recommendations is one way that we have shared our research and had impact from it. For me, I just love working in care homes. I love being in care homes, but whilst you might be the researcher there, you will get involved in all sorts. So you need to be prepared to do Zumba workouts, to be running the tea trolley. And I've also once featured in a pantomime because they were short of a member of staff. So yeah, people like that you're willing to get involved in everything. They have so many inspections, they have so many people coming in and doing things that actually, if you're willing to help out and say, I appreciate you giving me an hour of your time, what can I do to help you in return? That's always really positively received. But the most important thing I would say is have and get experience in care homes. It's really important to care staff. I find when working with staff, as soon as you say to them, I completely understand why you don't have time to do this interview today. I've worked in a care home, I've been there. People are like, you just get it, and you know why I don't have time today. You know I'm not being rude. So I would say that that's one of the most important things when you've got care staff as research participants, is them being able to see that you've had the same experiences as them, and you understand why things are so difficult. So that is a very quick overview of how I've ended up where I am. And yeah, look forward to the Q&A session. Thank you.
Thanks very much, Alys. It's really great to hear about the care that's being done, the research that's being done on dementia care. Obviously, a really important area that has a big impact on people's lives. and also to hear about the genuine involvement of people with dementia in direction and design of research, although I think personally I would draw the line at appearing in a pantomime. So a final reminder to put your questions in the relevant comment boxes, and we'll get to them at the end. Our last speaker today is Dr. Clarissa Giebel. Clarissa is a research fellow at the University of Liverpool and the NIHR Applied Research Collaboration for the North West Coast. And Clarissa's research focuses on enabling people with dementia to live well and independently at home for as long as possible, while also addressing potential inequalities that people with dementia might face in accessing the right care. So Clarissa, over to you.
Great, thank you. So going to share my screen now as well. So hopefully that should work. There we go. So thanks for having me. So I'm going to first have a little chat about some of the research that I've been heavily involved in the last year specifically. So as Alys was saying as well, now because of the pandemic, kind of our research can have shifted quite a bit. So my research usually is looking at how we can support people with dementia in the community. So my background is in neuropsychology, but I am heavily working in the social care sector now. So looking at how people are accessing services to keep well, to stay well. And so I'm going to talk to you a little bit about our ongoing research now into COVID-19 and dementia care. So what we've been looking at the University of Liverpool, but also more broadly across the UK and with international collaborators in Australia, India, Poland, and Italy, is how the pandemic and specifically these public health restrictions have impacted on the lives of people living with dementia and their carers, or unpaid carers, as we say, so their family members, friends, or neighbours. And we've looked at that from two angles, both at those people with dementia living in the community, but also how people with dementia living in care homes have been impacted on. So the latter is still very new and ongoing. So I'm going to share a little bit about our community-based work. So when we talk about social support services for people living with dementia, or older adults in general. So social support services, what we mean is daycare centres, for example, or peer support groups, or social activities in the community, such as singing and dancing groups. It can also mean paid home carers coming into your home and looking after the person with dementia to make sure that they can get out of bed in the morning, they take their medication, they have their food prepared, for example, or get a shower. So it's all these different types of services that help someone with dementia stay independently and stay well in the community for as long as possible. So when the pandemic hit, national lockdown in March last year, we were thinking, all right, all these services are being conducted face-to-face. They need that face-to-face support to be delivered. So how is that impacting? So what we wanted to understand is how the lockdown specifically has impacted on receiving care. And what we've done, we've done a few more things since then. I'm just going to focus on this for now. So back in April, so really only a week or two after nationwide lockdown was imposed, we started speaking over the phone remotely to carers and people living with dementia. And we asked them, for example, what are your experiences? Do you still get the same amount of care? How is the care being delivered? Do you feel any impact of maybe not having that care? And then a few months later, we've done the same. We've done remote interviews again with a subsample of those people. And just to highlight a few nuggets of those findings, one of the first findings that we found already in April, so that's only a few weeks after the lockdown, was that unpaid carers noticed a much faster deterioration in the symptoms of the person with dementia. And that's likely because, well, they were restricted to their own home. They didn't have that social stimulation of going outside, speaking to their peers anymore. And they lacked that cognitive stimulation as well. And since then, there's been other research that's supporting this, that unfortunately, the pandemic and the restrictions are impacting and leading to faster deteriorations in people with dementia. Another thing that we noticed as well was that there was a huge level of uncertainty in carers and people living with dementia in terms of, well, when will my father be able to go to the daycare centres again? But then also, how will these services resume? Will they resume with the same capacity of people? Will people have to wear face masks? And I mean, the pandemic is changing almost every week and the restrictions are constantly changing. So I suppose the uncertainty is still there, what's going to happen. But I think one thing as well, picking up on the faster deterioration, because carers noticed their relatives were deteriorating faster. So a huge unknown was and is whether the relative with dementia would actually be able to go back, because they might have deteriorated so much that unfortunately going out to these services wouldn't be an option anymore. And then one other thing that we looked at was paid home care. So as I just mentioned, on the left side, you can see a carer almost giving a hug to the lady, and that was pre-pandemic. And on the right side, you see how personal care is being delivered now. So full PPE equipment and trying to keep a distance if at all possible. And what we found was that many family members who had a relative with dementia were so scared of a possible virus transmission by paid home carers that they cancelled the care. But as a result of that, they had to pick up those additional caring duties and they felt much more burdened, which is something we've noticed. So we now have to think a few months down the line as well, if family members can't cope caring for their relative anymore at home, and people with dementia are deteriorating faster because they don't get so much care, that means people with dementia are likely to have to access a care home much sooner than they otherwise would. So, but also to complement that, and I think I just want to really highlight that dementia care research can be really broad. It doesn't have to be working in the lab. It can be in a care home, it can be in a community setting. We researchers often sit behind the desk as well. And sadly, we can't go out at the moment to speak to people face to face, but there are different ways in how we can collect data and understand dementia care. And one of the complementary things we've done, as opposed to just talking to people on the phone, we've also collected quantitative data. So we wanted to understand a more broader picture of how care is being provided. So what we've done, both via the phone and over the internet, is we've done a longitudinal survey. So at 3 time points, we've asked carers, older people, and those living with dementia how they've accessed care, social care, and how that's impacted on their mental health. So their levels of depression and anxiety. And that is a really, really fast forward view over our research. There's so much more, but I just thought to share that. And I'm going to unshare my screen now. And in terms of, I suppose, my career path, as I just mentioned, my background is in neuropsychology. I've done a master's in neuropsychology. But I quickly noticed when I did my PhD at University of Manchester that it was too removed from the person-centered care that I like and I need as part of my work. I want to speak to people directly and be as involved with them personally as I can. So I thought doing neuropsychological tests in a laboratory wasn't really my thing in the end. So I've kind of switched to looking more at the broader public health and social care angle. And I've been working now as a research fellow at the University of Liverpool for a few years. And why I think it's important to work in dementia research is I think we can actually try and achieve something to help people living with dementia and carers, particularly during this pandemic. I think this has really highlighted how important research can be to try and help people. And that's all from me.
Thanks very much, Clarissa. It's fascinating to hear about such up-to-the-minute research, and obviously very sad to hear, although really important to know, that the pandemic's being linked to a faster decline in people with dementia in care homes. So Clarissa was our final speaker today, so can I invite all our speakers to come back on video and off mute? And perhaps, Adam, I can hand over to you now for some of the questions that have been coming in.
Of course. Thank you, Stuart. We should add, Stuart mentioned at the start that he also works for the Dementias Platform UK, which, if you've not come across before, is a fantastic resource that so many researchers across the UK make use of. It pulls together all these fantastic data sets available from across the NHS and beyond to enable researchers to do so much of the work that they do. So it really is brilliant, and the Medical Research Council fund that. So if you're watching this and you're already in the field, you should go have a look at how their data might be able to support you. And thanks everybody for presenting. I'm really fortunate as well, because so many of the people who've spoken today have contributed so much to Dementia Research as a website in the past as well. Clarissa is one of our regular writers, and so you can keep up to date with all Clarissa's work in her blogs that she writes for us every month. And Alys has written blogs, and I think you've been on the podcast a few times as well, Alys, as has Claire. Yep. And Jemma, we haven't got our hooks into you yet, but hopefully we'll get you contributing more. We've had quite a few questions. I'm not surprising, because so many people working in dementia research have this background in psychology. It's fascinating that so many people can bring their skills in different ways, and how similar your backgrounds are, but how different everybody's research is wonderful. So the first question comes from H&M, who asks, how did you go about getting experience in a hospital ward? I'm a second-year university student with no prior experience. Who might like to take that? And maybe I'm going to pick on you, Alys, I think, because it sounds like you've had the most, so it might not necessarily be in a hospital ward, but it sounds like you've had the most, lots of hands-on experience in volunteering. And
yeah. I mean, certainly when I was at Bangor, there was a kind of society which was set up to support people who wanted to do volunteering on a hospital ward, and that was in an acute ward in the local hospital. So I think there were normally things going on in the departments that support that kind of experience. I mean, if it's care homes that you're interested in, present time excluded, they are normally desperate for volunteers to go and help with activities, just to go and sit and chat with people every week to help with making sure people, for example, can go outside and go for a walk. There's all sorts of things that care homes would want volunteers for. I guess obviously the issue is, at the moment, that's a lot more difficult, because like Clarissa said, none of us are setting foot in a care home at the moment. So it is a difficult time to try and do these sorts of things. But I think speak to staff in the school that you're based in, especially those who are doing that kind of research, because they'll have the networks and the links to know who the best people to approach are to get that kind of experience.
And that does help, doesn't it? If you're going on to apply to a master's program or a PhD, there is that space on we talked about this week, the space on the form to say what experience have you got. So, and I completely agree on the care homes. They're, I mean, usually under normal circumstances, very keen. I go into the care home near me and I've just read. I go and do reading. Jemma, I know, is that something you touched on in yours? Is that something you could add to as well?
Yeah, absolutely. I think what Alys said is definitely right. Care homes are desperate for people to go and sit with patients, which is a lovely thing to do as well. It's very enjoyable. I also did this as well as becoming a healthcare assistant. So you can sort of apply to this in a hospital ward. You don't need much experience apart from just being a nice, normal person. Again, they're desperate for people to go. It's also a good way to earn a bit of money at the same time, which can always help with this sort of thing. But again, yeah, you're just basically sat with patients and spending a lot of time with them and their families as well who come in and visit. It's really important to get involved with the families, I would say.
Yeah, absolutely. And it is a great way to earn extra cash, particularly if you're studying part-time, which I know some people will be studying part-time and maybe doing a master's alongside that. So that's another thing to consider, and Clarissa wrote a blog for us on that subject exactly this week, which you'll find on our careers page. On it is quite possible to, so a master's would usually be a year full time, or your PhD, obviously, depending on where in the world you're doing it, but kind of 3 years-ish. But it is possible to do these things over longer periods and work as well, and always easier, I think, if your job is also related to the thing you're studying. So that's another way to go if you simply can't afford to be in full-time education. The next question comes from Alex, and it says, Jemma mentioned trying to gain some experience through asking PhD students if you can assist them. Where would you find the PhD students and know their topics? And a second point to that is, and are there any other ways or places to gain experience in research before doing a research assistant role? So that is a little bit of a different question, because that's about research experience rather than care or clinical experience.
Yeah, I think I could start with the first point there was just about the PhD students and postdocs, which is definitely something that helped me. Honestly, it's just word of mouth and just being very chatty with people. So for example, if you're in just like in the good old days when you're in an open office with lots of people around, it was just nice to talk to people, see what people are doing as well, just asking people whilst they're having lunch in the kitchen, just chatting to them about the research that they do, and then just saying like you'd be very keen to help out wherever you could. That's definitely what I ended up doing. And then I guess the point about the research assistant role is again the same sort of thing. So you could be involved with PhDs or postdocs helping on their research, and then also, as a few other people have mentioned as well, doing internships is a great way to get that on the CV as well.
And yeah, I think, was it Claire, you mentioned having done a summer internship, and I saw that this is the time right now when they'll be getting advertised as well, won't they? And the decisions being taken about whether these can go ahead and will they be face-to-face and what format they will take. What's a summer internship entail?
So I think then normally about 6 to 8 weeks. So like I said, mine was in the psychology of eating behaviour. So my kind of day-to-day role was mainly kind of recruitment and data collection. And then at the end, it really is kind of an end-to-end project where you start with like your kind of very small research question, do all the data collection and then try and get it analysed at the end. The BPS one, the British Psychological Society one, was really nice because they kind of forced you to go to a conference at the end with the other summer research internships and present what you'd been doing. So it is kind of like an end-to-end mini research project and quite good preparation for your final year dissertation if you have to do one of those.
Sounds great. Is that something, did you do any internship work, Clarissa? Because you worked, didn't you?
Yeah, sorry, audio. Yeah, I actually did that BPS internship with a very nice clinical lecturer at University of Manchester when I was in my 3rd year doing my undergraduate there in psychology. It was for 8 weeks, I think, and then I went to a conference afterwards, and that really helped me get that first research experience and then simultaneously secure casual researcher post, which then ended up being my proper job. So, and as part of that job, I kind of got linked in doing my PhD as part of it. So it kind of, you might not think something builds up to something bigger, but sometimes it's those little things you do, and then you build up those connections, and then you can, you gain better ground.
And I know lots of the people who are watching today might not be Twitter users, because we've discovered through organising our Careers Week that far more of the undergraduates that we were hopefully encouraging to attend this were more on other social media platforms and not Twitter. But Twitter is a great place for this, as much as it's a terrible place as well. It is a great place to make connections. So if you're just an Instagram user at the moment, you really should jump across and have a look on Twitter and have a look at who follows the British Psychological Society and maybe follow some of those people as well, and you will make a lot of connections there. The next question is from Matt, who asks, have any of the speakers had experience of working with the board certified behavior analysts within their research, and how useful do they think behavioral interventions are on treating Alzheimer's? And what are your opinion on non-pharmacological interventions for Alzheimer's? Do you think these are effective as drug treatments? I'll take that last one to start with. Everybody, I'm fairly sure, in the world of dementia research is fully supportive now of non-pharmacological interventions, partly because as well there aren't any pharmacological interventions, which is none that have been significant. There hasn't been a new licensed drug for dementia for over 17 years now, and CBT and conversation analysis and these other things that we're actually going to talk about in our healthcare webinar at 12:30 tomorrow, have made some fantastic strides. And in fact, there's a blog on our website, which we've just brought to the top of the list today, from Dr. Anna Volkmer, talking about some of the interventions that have been developed over the last 25 years. So do have a look at that. Would anybody like to take this question, though, about whether they've worked with certified behavior analysts and your view on behavioral interventions? So nobody's worked with any board certified behavior analysts. Would anybody like to give an opinion on because have any of you been involved in using or implementing non-pharmacological interventions? Alys?
Yeah, so I worked on a 3-year clinical trial that looked at evaluating something called dementia care mapping in care homes and how that impacted on people with dementia. And actually, what we found that it wasn't effective, but what we found was the issue was that staff weren't able to put it in place. So they either didn't have the time or the resources or the necessary support. So I think one big challenge for dementia research at the moment is that we've got lots of interventions. We've got lots of different things that we think work. We've got lots of things to test, but actually care homes aren't necessarily ready to take part in these big research studies, and they're not necessarily ready to do that going forward. So when we're saying to people, can you do this for 6 months? That's great. When we're saying, can you then keep it going after that? And see if we think that this is effective for your residents, can you then implement that going forward for as long as it's evidence-based practice? And that's really challenging. So actually, I think a lot of the issues that we have are around implementation of things and around how we help care staff and hospital staff and relatives of people living at home understand what is needed to kind of engage in interventions. So yeah, I think more of the challenges around how we do things rather than what we do, because a lot of things that aren't effective, it might not be because the intervention isn't effective, it's that actually the world that we're trying to work in isn't ready to try and do these things in practice, if that makes sense.
Of course, and there has been quite a lot of money invested in researching in this field in the last, well, since 2012 particularly. I think since the last big dementia-themed call, the Economic Social Research Council has invested quite heavily in this field, as have the National Institute for Health Research, and there's lots of work going on. I'm thinking of places like Exeter and UCL as well, and Bradford, of course, has done lots in this space as well, looking at those interventions and not only testing their value, because of course the challenge then is of course you do have to persuade healthcare providers to commission those services to be something that's implemented and maintained. Clarissa, I'm conscious you have to go now, so we will just thank you very much for joining today.
Okay, bye. Thank you.
Our next question. Oh, and for anybody who wants to know, most of those people like Professor Linda Clare and other people like this that work on these things, they're all on Twitter as well, and you can follow them and have a look at their publications. Or go to the UCL website, and quite often they will also, having attracted the funding, advertise research assistant jobs for people who've got that have their MScs but not necessarily got their PhDs yet. So do have a look at our website. We do try to keep up and advertise all those jobs, and on places like UCL and Exeter's websites as well, where a lot of that work happens. Maisie asks a question to all panelists. Does anybody have any advice for a first-year undergraduate psychology student interested in dementia research and gaining experience? All of the volunteer roles that have been advertised are working in a caring, ask for experience of already working in a care environment. Isn't it? We've already talked about this a little bit. Do you think care homes are less likely to they're more likely perhaps, do you think, to give you that first go?
Yeah, definitely.
The care homes are so keen to have people who, as long as you can get through the CRB check, I imagine there's still a CRB check for volunteers.
CBS.
CBS, sorry.
Just renamed.
And old. And go to some of the large organisations. So ones like the St John's, is it the St John's Care Trust?
Order of St John's, is it?
That's right. It's the Order of St John's, the OSJCT, the Order of St John's Care Trust. You can approach them, and some of the larger care home providers probably have details on their website that connect you in. But it'll often be once we get through the next few weeks, go knock on the door of your care home, few months perhaps. But that is a great place to start.
I think also, so like I worked as a kind of care assistant doing some of the activities, things like I had paid employment as in the care home, and they are always looking for people for paid employment as well. And they're normally really happy to fit around your university hours. And it's hard work, it's exhausting, and it's not always the most rewarding, but actually it can be really helpful when you then want to go into research in this area to say, look, I've come with a psychology degree, but I've also worked in the care home, so I know what this is like from all the different angles.
Yeah, and of course, either through a master's or afterwards, you can go to your, you can do voluntary work with the charities as well. So Alzheimer's Society do have a volunteering program, and that can also involve supporting some of the research processes that happen if you're looking to get hands-on with some of the research work there. There's a question here which says, for all speakers, what's been the proudest moment of your career so far? Go on, Jemma, would you like to say that one first?
Sure, I think I have the shortest career of the three of us, so makes sense me going first. I would say probably the proudest moment for me was moving to Oxford, which sounds really sad, but I come from a really small town in Wales called Barry Island. If you watch Gavin and Stacey, you may have heard of this. And
it's made Alice very happy, look.
Yeah, I thought so, yeah.
Somebody else Welsh on the panel.
So I mean, Alice, you might know a lot of people never leave Barry. It's not very common. People go to Cardiff University, and that's that. So for me, getting into Oxford and moving to Oxford was definitely the biggest thing for me.
You didn't know each other before today?
Not today. I think we will now.
Yeah, we come from like 4 hours apart from each other just because it's the same country.
I wasn't suggesting that you know each other because you're both from Wales, but I meant, did you know it? You didn't know each other before. Oh, I didn't mean that. So that's entirely a good reason to be proud. What about you, Claire?
It's a difficult.
What would your mum say was her proudest moment, perhaps?
I think my mum would say, my mum is a regular listener of the Dementia Researcher podcast. I hope not. But so we launched a study called Game Changer, led by Alzheimer's Society back in 2018, and it's still open. If you want to get involved now, just search joingamechanger.org. But this launched on World Alzheimer's Day in 2018, and getting everything ready for this research study, which had quite a public launch, was terrifying. And when we managed to put it all together, and it's now got like 20,000 people taking part. So seeing those thousands of people sign up in the first few days and nothing majorly going wrong was probably the proudest moment. I don't know if that's a good thing or just avoiding disaster.
No, well, it's great. I mean, so far we'll come to Alys next, but it's great to hear because there are some fairly typical answers you might have given. It's that, oh, my first publication, or my, you know, graduating, or things like that. But what would you add, Alys?
So I think mine it is a paper, but it's the paper that I wrote with a person with dementia, seeing that published, because actually I think we're really good at talking about what is needed for people, but writing that with her was kind of going against everything I'd ever done for scientific writing, and being like, okay, this is led by what she thinks is important. And yeah, I think because I'm so involved in kind of having the inclusion of people with dementia in research, that was actually doing it properly and having something that she has it on her wall. So like, it meant such a lot to that family. And yeah, doing things differently and having the person with dementia telling me what to do rather than us saying, this is our research, what do you think?
And that's really inspiring. I mean, if anybody's looking, looking for motivation as to why to do any of these things, I know personally having a direct line of sight between what you do and knowing that what you're creating really is going to help people, I think is all the motivation you'd ever need to work in dementia research, because there is so much to still do, right? Whether that's Claire's fantastic work in understanding, what causes the disease in the first place, the impact of genetics, and Jemma's work as well, or Alys's work on how, that great work you did on cancer and dementia, which is something that's just not looked at. There's so many great and different ways, and such an opportunity to carve out your own little corner, particularly in dementia research, because there's so much to do. So you can come with a completely new idea and really run with that and make it into something, probably more so in dementia than dementia research, I think, than many other areas of care. Thank you. I hope that answered your question. Alex asked the next question. Do you have any good websites to find internships? So British Psychological Society, I think, was one that everybody pointed to. Any other quick thoughts or suggestions for internship places to look?
I would say Twitter. I know we've already mentioned Twitter, but most people are kind of signposting their opportunities on social media now. So I'd definitely sign up to that and follow some researchers whose work you like.
And do sign up to our website. So we have a few people that look at Twitter, and if we come across anything that we think would be interesting to our members, we do repost that into the website, and then we send out a news bulletin every Friday. So if we come across summer internships that are open to applicants, we'll put that into a post on the website. It'll go out on the bulletin on a Friday, because it can be quite hard to keep on top of that, isn't it? I don't know about you, but I only ever see tweets if somebody tweeted 5 minutes before I went and had a look. Anything longer than that, I'm probably not going to see it. So we'll have a look on our website, Alex, and in our section you've got a whole bit there called Essential Tools, which we'll make sure has links to those as well when we come across them. And we've got one more question, which comes from Lois, who asks, how important would you say it is to be following a certain career path like dementia research early on? Were you set on working in dementia earlier on, or did you, make sense of this? I think the point here is can you change career paths? Does it matter if you don't settle on dementia earlier on? And then the second point is were you very set on dementia, or did you try out some other fields of work experience as undergrads, like health psychology or clinical work? So Claire, you mentioned you did your internship in something different. Did anybody else come to dementia later on, or did you go in straight out of undergrad into dementia? Alys, go on, you go first.
So my internship was in chimpanzees, so that was completely different.
Did you remember thinking that? Oh, that's unusual.
Yeah, no, it was unusual. So yeah, I moved from chimpanzees and then did PhD in mental health, and then came into dementia. But I guess it was because in my PhD I'd looked at mental health of people working in care homes. That was kind of how I came in. But I don't think it's important. I think it was Jemma saying that it's important that you love your PhD and you find something that matters to you. And I think if you're looking in kind of health or clinical psychology, you'll find the illness or the age or the area that interests you most, but people can see the value of any experience in that area broadly, and that actually a lot of it's adaptable. If you've worked in care homes and hospitals, you've worked with a large range of people, and people see that as valuable.
Yeah, I can understand that. So not from your point of view. Did anybody else have, Jemma, did you want to add to that?
I think, yeah, very, very similar, really. I mean, for myself, it seems like it was always set out in stone that I would end up in dementia research, but I never really realised that until I was here. And then I thought, oh yes, of course, everything has led to this point. But there was definitely a few parts along the way where I tried out different things. I did different types of internships, volunteered at different places. Anything you try is good because it helps you realise if it is or isn't for you. So it definitely works both ways.
Yeah. That's so by all means do. I mean, one of the reasons for holding this careers festival this week is to try and encourage people to consider dementia at all. That isn't to say you can't think about other things. You can date other people, but you've got to come back to dementia in the end. Claire, did you have anything to add to that as well?
Only to kind of agree with what's been said so far. I mean, I originally wanted to be a clinical psychologist and got kind of some hospital experience during my undergraduate and decided actually it wasn't for me to be a clinical psychologist. And I also applied for PhDs in a range of areas, but I think when you kind of connect with somebody's research experience, we had a podcast on this the other day, like picking your supervisor very carefully. When you kind of find the research area and you're like, oh, that sounds like that's the one, you kind of know.
So we hope we've made a case. I mean, I think we've made a good case over the course of the week why you should consider dementia. We've got lots of blogs and people trying to suggest that you should on our website. But also, as we've said, I think, first of all, the government has committed to doubling the amount of funding available for dementia research in this parliament. So we're hoping that the government will invest significantly, which should increase the number of opportunities for people to work in this field. Having that working with people with dementia can be very rewarding, particularly when you are creating and adding to that body of knowledge that is really making such a difference, whether that's in care or prevention or in supporting people or improving diagnosis, which is something that psychologists are looking at a lot, and developing new biomarkers. These are all fascinating fields to work that people with undergraduates in psychology are bringing their expertise for. And yeah, there's still so much to learn. So we hope you found that inspiring. That was our last question, Stuart. The only other thing I would add is that we do have a healthcare professionals webinar at 12:30 tomorrow, which includes a presentation at the start from Rebecca Dove from the NIHR Academy, who's going to be talking about clinical academic opportunities and what the NIHR will fund there. So if you are thinking about doing clinical psychology or going to work in the NHS, you can still pursue an academic career funded by the NIHR in that path. So you might find tomorrow's webinar interesting as well. We have a speech and language therapist and a nurse, 2 nurses, and then a physio presenting tomorrow as well. Thank you, Stuart, and thanks, Jemma, Claire.
Thanks very much, Adam. In that case, all that's left for me to do is to say a huge thank you to our 4 speakers today, all of whom have given some really interesting perspectives on how they got into dementia research as a career. I was really struck by the personal motivations for getting involved, as well as the scientific curiosity. Many, in fact, probably most of us will have been touched by dementia personally at some point, and it's interesting to hear how that's inspired people to embark on a career in dementia research and hopefully contribute towards those new treatments, the early diagnosis, the better care that we've heard about today. So thank you to our speakers. Thanks to all of you for watching. As I said earlier, there's lots more content available on the Dementia Researcher website on the careers page, and these webinars have been recorded and I believe can be watched back on the website or YouTube channel anytime. And if you can, do come along to the informal coffee break session tomorrow at 4 p.m, where you can chat to some of our early career researchers. Adam, is there anything I've missed, anything I've failed to plug that I should do before we sign off? Excellent.
No, I don't think so, Stuart. I think you covered absolutely everything today. I don't know if any of our panelists from today are going to be at the coffee session tomorrow, hopefully. So yeah, 4 o'clock on Wonder Emmy, and you can come along and chat face to face and ask some questions, and just, you know, by all means do. It's all very informal, so do come along and say hello.
Excellent. Well, thanks very much then, everyone, and bye for now.
Bye.